and we are all well equipped with this. And primarily, yoga and consciousness is one of the most attractive and one of the most profound curriculums which is taught there in the Nalanda University. You know, there is a standard compendium, as you have aptly mentioned, that it should be Shruti, Yukti and Anubhuti. Shruti means the scriptural wisdom, Yukti is the logical analysis, which must be verified and verified by the experience or the experiments. So in the realm of material sciences, we conduct experiments, and here we have to conduct the experiment by ourselves only, within ourselves, so that we have the experiences. And therefore, you see, these courses, and there is a standard compendium called Patanjala Yoga Sutra, and there is another standard compendium called Brahma Sutra, and that is taught in its entirety in one of the rarest universities, which is the Nalanda University. At the same time, we are developing research centers, a huge yoga and meditation hall, which has the capacity of accommodating more than 300 practitioners at a time, and we are giving fullest of our strength and our energy to fulfill the vision of our visionary Prime Minister in realizing his mandate of Vikasita Bharat.
Thank you very much, Dr. Mukherjee. It's been a personal privilege for me to listen in to all the esteemed panelists for today. I would now request our worthy chairpersons to deliver their concluding remarks.
Thank you, Dr. Gandhi. I'll start where I left, and also taking cues from various speakers before me, especially Dr. Chandrasekhar spoke about, study in India program. Somehow, most of the things which were spoken here, I was in the background related with some of the policy formulation somewhere, including the new education policy. I was looking after education at that point of time also, while it was being framed and most of the discussions were being held. So that's one of the motive, because India has been a knowledge powerhouse for centuries and millennia, and as it has been rightly pointed out that this is a time for maybe new Lananda, new Takshila, new Vikramshila, and where we are sitting right in Gujarat, where Vallabhipur University was there. So these Oriental sciences has given highest level of, intellectual answers to the humanity in the form of Ayurveda, in the form of even surgery in Sushruta Samhita, in the form of all kind of material research and mathematics, whether be it the invention of zero or decimal system, which has given the edifice for modern sciences to develop. So this is a time to reclaim probably that glory with the validation from evidence-based learning and evidence-based science, and reclaiming that space. What is most important is the collaboration, academic collaboration, research collaboration, South-South collaboration, and I think in both policy and practice we have been doing that. As I was just discussing with Dr. Ved Prakash also, and which was also spoken by Her Excellency Hirasoa, when today's day is also very, very important. I recollect back 4 years back in 2020, 17th January, was the day when, a day before this, the first COVID virus was found outside, detected outside China's mainland. And this was the day when we started surveillance at 6 airports in the India for inbound flights. And then the entire research and academia, Dr. Unni Krishnan mentioned about that COVID vaccine development was a joint effort.
domain of ifs and buts in our minds, even in the zone of speculation. I was just contemplating 1965. The famous social scientist McLuhan made a statement that the world is shifting from the concept of a unitary village into a global village. And these last 5 decades perhaps have completed that predictability in its 360-degree dimension. Independent of the nature of cooperation and collaboration that we are wanting to be putting across in the name of be it South, 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 North, or the globe and universe as a whole, as rightly pointed out by my fellow chairman, pertaining to the One Health, that is the way forward from here onwards. All of us have to bear in mind one thing very loudly, very clearly, and very candidly. The most philosophical prediction which came to be made, and which was poverty and deprivation anywhere is threat to prosperity everywhere. And this is the underlying context which we need to harbor in mind. The collaboration basically contemplates all of us to rise in unison. Basically because needs are common, requirements are common, expectations are common, concerns are common, and challenges are common. Therefore, way forward will also be a near common for all of us. I am happy to share with you that bulk of discussion that we have had. The paths which have already put into operation, they have been put across. The policy frames which are needed for the coverage of futuristic dimensions, diligent steps are being taken on to that particular consideration. But take it from me that until and unless meager structural universalization will not be in a position to be rendering desired outcomes, it is the operationalization which is expected to be the real hallmark. Holding hands cannot be just for the purpose of diplomacy. Holding hands, when they mean for the purposes of sharing, with concern, with compassion. I was just thinking for myself, it's very easy to pity something. But psychology says compassion begins with pity, goes into the domain of sympathy, enters into the portals of empathy, and when action is actualized, it gets transformed into compassion. It's a compassionate South-South dialoguing which is the hallmark of it. And therefore, globalization in terms of the structure in the domain of academia, substantially achieved. Today when I'm in a position to speak for health sciences, universalization of objectives have been achieved, universalization of attributes have been achieved, universalization of outcomes have been achieved, universalization or globalization of outcomes have been achieved. Why? Because needs are common, expectations are common, concerns and challenges may be different, but the way forward is common. It's in that context, ladies and gentlemen, as very rightly put in by the panelists through a very erudite dispensation by the moderator, I am pleased to share that definitely this panel discussion has